According to a study, the effectiveness of a blood test for prostate cancer remains consistent across different ethnic groups. Greetings, everyone! Today's video focuses on an intriguing study that reveals the remarkable efficacy of the Stockholm 3 prostate cancer blood test in various ethnic groups. This includes white, Asian, African American, and Latin American men residing in both the USA and Canada. Notably, the test has proven to greatly minimize the need for unnecessary biopsies, all while accurately detecting clinically significant cases of cancer. The research, spearheaded by Hari T. Vigneswaran, demonstrates that the test's reliability remains consistent across different ethnicities, thus paving the way for its potential widespread adoption. Now, without any further delay, let's dive right into our discussion. Developed in Sweden, the Stockholm 3 prostate cancer test utilizes a combination of protein and genetic markers extracted from a blood sample, which is then analyzed through an algorithm to determine the likelihood of a patient having clinically significant cancer. Research conducted on a sample size exceeding 90,000 individuals has demonstrated that the Stockholm 3 test yields markedly superior outcomes compared to the current PSA standard. This innovative diagnostic tool effectively enhances the accuracy of prostate cancer detection by minimizing the need for unnecessary MRI scans and biopsies, while simultaneously identifying significant malignancies in men with low or normal PSA levels. The effectiveness of previous studies conducted in Scandinavia, primarily on a predominantly white population, cannot be confidently applied to the global population. To address this limitation, a research team consisting of Swedish and American scientists has recently investigated the efficacy of the treatment in a diverse group of men from the United States and Canada. A comprehensive study was conducted at 17 clinics, involving a total of more than 2,000 male participants. The racial composition of the participants was as follows: 16% Asian, 24% African American, 14% Latin American, and 46% white American. Each participant was referred for a prostate biopsy due to various factors, such as an elevated PSA score, abnormal rectal examination, MRI scan, or other concerning clinical indications. Prior to conducting the biopsy, relevant clinical data and a blood test were obtained, while the Stockholm 3 test was carried out without knowledge of the biopsy outcomes. The findings indicate that 29% of the male participants had clinically significant prostate cancer, with a slightly higher prevalence among African Americans and a slightly lower prevalence among Asians. Additionally, the study demonstrates that the Stockholm 3 test has the potential to reduce unnecessary biopsies by almost 45%, from 1,226 to 673, without compromising its ability to detect all relevant cases. These results remained consistent across various ethnic groups. According to the lead author of the study, Hari T. Vigneswaran, who is a doctor and PhD student at the Department of Medical Epidemiology and Biostatistics, Karolinska Institutet, the study reveals that the Stockholm 3 test is equally effective on a diverse ethnic group, as it is on a population of white Swedish individuals. As per his perspective, the research provides solutions to numerous significant inquiries and will pave the way for a broader adoption of the approach. The data indicating the effectiveness of Stockholm 3 among non-Swedish populations and minorities has sparked significant interest among colleagues in different countries. Funding for the study was provided by the Swedish Research Council, the Swedish Cancer Society, and a 3P Biomedical, the organization responsible for the development of the Stockholm 3 test. Hari T. Vigneswaran and Thorgerdur Palsdottir are affiliated with A3P Biomedical. Henrik Gronberg, Martin Eklund, and Tobias Nordstrom, who also have shares in a 3P Biomedical AB, are co-authors of the study and hold patents for the method. Additionally, some of the other co-authors have disclosed receiving research grants and fees from various pharmaceutical companies unrelated to the Stockholm 3 method. To support our channel's growth and ensure broader awareness, kindly hit the like, share, and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.